and welcome to another episode of Between Two Foxes. Today, I'm joined by Dr. Jeff Midgley, Clinical Associate Professor and Director of the Physician Assistant Program here at Marist University. Jeff, it's great to have you here with me today.
Thanks for joining us here in the Allied Health Building.
So as I say to your students and to you and your faculty every year, the PA program at Marist is a true gem. Launched in 2016, it is already our most competitive program with respect to admissions. Our students, the first 7 cohorts, have a 100% pass rate on the certification exam, the PANCE. Tell us a bit about the program and about your students.
We are now going to be seating our 10th cohort this year, which is really exciting. We will be graduating almost our 400th student as well this May, which is really nice as well. But it's really all about the culture that's cultivated at Marist that kind of trickles down into our PA program, which is what I really love about it. It starts at our admissions process with the students that we select and has gone throughout our faculty, staff, as well as our administration.
And this culture just doesn't happen by itself. I've gotten the chance to see you and your fellow faculty engage with the students and just how much care and concern you have for each other. Your students work really hard, faculty work very hard, and by the end, whether it's the white coat ceremony or graduation, they really feel like they've bonded and become tremendous friends and colleagues in addition to fellow students.
And that's really what I like about here. And it's one of those things that I really noticed when I stepped foot on campus back actually in 2014, where it was just like a feeling and sensation and just an aura. You just feel that on campus at every level, which is really, really nice.
All right, Jeff, so let's talk about you for a little bit. By your own telling, you were a bit of a late bloomer. You came to this field in a rather circuitous way. Tell us about how you came to this field and your love for it and how it was always a passion of yours.
So it all started when I was 5 and I was diagnosed with a heart murmur by my pediatrician, and I was sent to a specialist, and being so little, I could see only 2 things. I could see my heart beating on a screen, which was pretty darn cool, and I could only see his Argyle socks, which was at the time probably cooler. So I demanded to go to Sims on my way home to get Argyle socks, and I frequently wear Argyle socks as a result. But that inspired my interest in medicine. I really struggled to find my way in college. So in that large lecture hall environment, I just got lost. And then I was just in the dorm with a couple people, and they were talking about applying to medical school, which again, that was my dream. They said, you know what, we're gonna join this ambulance agency and we're gonna become EMTs to strengthen our application. I was like, oh, that sounds great. We all got in and we all became a part of that. So I started as the driver. So I was driving on every single ambulance call that Binghamton University had to offer. Then from there, I said, hey, this is something that I'm pretty good at. So I became a training coordinator there. I then became a medic.
Wow. And you know, at Marist, we talk all the time about finding your passion and following it because you have no idea where things are going to lead you. And that sounds like that's part of your story.
That's when I felt like my potential was unlocked, where I found my place in medicine. And I was able to continue to do the things that I loved to do and show people that I was capable and that I wasn't defined by these poor grades in undergraduate.
So then, Jeff, what attracts students to the Marist PA program? What is it that makes us unique and special?
We actually ask all of our applicants this question. They pick the same 3 things: the strong outcomes, so the high PANCE pass rate on the first time, as well as a high overall, a relatively low attrition rate, and then also cadaver lab. But once they come and meet us, then it's really the culture, the personalized experience that they're going to get at Marist, in the PA program, as they would as an undergraduate student. They see that in every step of the way in the application process.
All right, Jeff, now it's time for the lightning round. Let's learn a little more about Jeff Midgley.
Okay.
You are a huge fan of Disney World, and you've been to Disney World dozens and dozens of times. Favorite character?
Goofy.
Any reason?
He's goofy.
Okay, so appropriately named. You've been on several Disney World rides before they were open to the public. Yeah. Terrifying or exhilarating?
Exhilarating.
Okay, you felt they were safe? You were ready to go?
100%.
And what's your favorite ride?
Favorite ride is Big Thunder Mountain at Magic Kingdom.
Still Big Thunder Mountain?
Big Thunder Mountain.
I went on that when I was a kid.
Yep.
Star Wars or Back to the Future?
Back to the Future.
Why?
Because it's the best movie ever made.
The best movie ever made?
It's so iconic.
What is your favorite line?
Make like a tree and get out of here.
I like, I'm sorry kids, you're just too darn loud. So you're a semi-professional race car driver, in part from your love of driving ambulances really fast. What is your favorite racing track?
So Monticello Motor Park is my favorite right now, just because there are a lot of track days that they offer to the general public, and it's a track that I could probably do with my eyes closed from now.
Favorite Marist color, red scrubs or white coat?
Red scrubs.
Right answer.
Yes.
All right, Jeff, there's a lot of fun stuff in here. Can you show me around a little bit and show me what your students do every day?
Yeah, of course. We got a clinical student here to help us out.
All right.
Ready to get started?
Let's get at it.
All right, great. We have second year PA student Claire Finnegan.
Hi, Claire.
Right now, we're going to start with donning some sterile gloves, and we have to be very careful to not mess up the sterile field. You can't touch the fingertips. You want to start with touching the cuff, and you work your hand
Work your
in,
fingers forward. All right.
and then make sure that
You've
it
done
goes
this a few
up.
times.
Just a few.
All right.
There we
Well,
go.
there you go.
Good.
I think I got that right. I didn't touch the outside of it. All right. So we got to stitch somebody up here.
Yeah.
So grab the end of the needle.
Right here.
Yep.
Yeah.
There you go.
Yeah.
Oh, it worked. Okay.
And then you can pull it out. Now we're going to start with our stitches.
All right.
So you'll pick up your forceps, like kind of a scooping motion. Perfect.
You got it on both sides.
I got them both sides.
Yeah, try to get it just through one side. There you go.
This doesn't hurt them at all, right?
No, it's all
They
numbed up.
feel nothing.
All right. All right.
And then you pull through.
That's perfect.
Like this.
Yep.
I'm going to ruin your perfect pass rate. You let me keep doing this.
So this is called endotracheal intubation, where
Okay.
we're using a device called a laryngoscope, so I can vocalize the patient's vocal cords and put this tube in so they can breathe.
Okay.
And basically, as soon as I get it in, what Claire's going to do is going to put this tube right on top, so that way we can ensure that this patient's going to be able to breathe.
All right. I'll stand
All right.
out of your way here because.
You know? Nice.
And when this happens, we like to see that both lungs are inflating to ensure that we are in the right spot.
Are you ready
Are
to
we
try
ready?
and beat Director Midgley's record here?
Let's try.
You got this?
17 seconds.
All
Teamwork.
right.
All right.
Good. And then you can put it on.
On.
Yep.
Nailed it.
I'm not sure we broke the record, but we definitely saved her.
She's breathing, and that's all that matters.
All right.
Good.
Well done.
Thanks.
Thanks, Dr. Midgley. Thanks, Claire. I learned so much from you here today. I think we can shake hands now because we're past the point where we needed to be sterile.
Thank you so
Really
much.
enjoyed that. Thanks for joining us on this episode of Between Two Foxes. Until next time, go Red Foxes.
Woo!
Woo.